7 people believed to have been in contact with a 27-year-old Kenyan who tested positive for COVID-19 have been isolated as the government moved to contain the spread of the deadly virus. Health officials have also been deployed to Rongai to conduct tests on tens of people believed to have come into contact or living within the building where the 27-year-old Kenyan who tested positive lived. Health Cabinet Secretary Mutahi Kagwe says the government had traced more people said to have been in close proximity to the patient. Mutahi Kagwe reports.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
An announcement that has left the whole country in panic.
The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya.
Health Cabinet Secretary Mutahi Kagwe saying the 27-year-old patient was in isolation and in stable condition, even as he called for calm amongst the panic-stricken population.
Her temperature has gone down to normal. She is behaving normally. She is eating, but she cannot be released until the tests continue, until she gets negative.
The lady who arrived from the United States last week Thursday was residing in Simba Drive, Ole Kasasi area Rongai. Ministry of Health officials have since located the estate and put 7 people residing in the same flat and believed to have been in contact with her on isolation at the 120-bed capacity isolation unit at the Mutahi Hospital for close monitoring.
She was living on her own, not with the family, but she has been in contact with people. And there was a question about whether we have traced them or not. And I can confirm that we have traced. Not even that. We have even traced the passengers who she was sitting next to.
The young lady said to be a student traveled from the state of Ohio to Chicago, where she took a connecting flight to London, United Kingdom, before taking another flight and landing at the Jomo Kenyatta International Airport. She then proceeded home to Rongai. Reports indicate she later travelled to her rural home in Kitale through a Nissan shuttle before returning to Nairobi. Having landed on the 5th of March, it appears the symptoms of the virus were yet to manifest, since at all points of entry and even in aircrafts, there is regular screening, especially if the aircraft originates from an epicenter. Travellers from such regions are advised to self-quarantine for at least 14 days.
I want to thank her so much, because the minute she started feeling slightly unwell, she felt that she should go to a hospital. She took herself to the hospital.
The government now scaling up efforts to contain possible spread of the deadly virus, with health officials working against the clock to trace all who came into contact with her.
What we have is a coronavirus positive test. No more than that. Therefore, Kenyans will live normally. Wherever you are going, go normally. Carry out your business normally. Go to the shopping center normally.
The question was not if, but when. With the first reported case and amid the anxiety and panic that is bound to strike the country, Kenyans have been urged to observe basic hygiene, avoid contact especially while greeting, and constantly use hand sanitizer that will help in containing spread of the deadly virus. Mutahi Kagwe, Citizen TV, Harambee House, Nairobi.